Hi everyone! Okay, so welcome back to another anatomy video that I've got for you all this week. So today's video is going to be me essentially just trying to give you guys another method that you can use to apply to like some of the concepts regarding our lower limbs. So for today specifically, I'm going to be focusing on the femoral triangle. You already know what this is. It is that triangular shaped space located in our upper thigh, and what that space does is it provides a passageway for a femoral nerve, artery, and vein to pass through. So what I'm going to do in this video is essentially I'm going to go over the component parts of that triangle and then offer some scenarios afterwards for you guys to get some more practice. So let's jump right in. So first, this is a cadaver-like cartoon image of the femoral triangle on the right thigh. So as you can see, the borders of the triangle are made from our sartorius muscle on the lateral side, the adductor longus muscle on the medial side, and finally our inguinal ligament forms the superior border. And if you look a little closer, you can also see the nerve, artery, and vein that are passing through this space. So now that we have seen a semi-lifelike image of the triangle, I want to show you a more simplistic picture that I drew personally to help explain our mnemonic devices a little more easily. Alright, here is a diagram that I drew to help with our understanding of the component parts of the femoral triangle. So as you can see, this is our right thigh again. Our sartorius, adductor longus, and our inguinal ligament are creating the borders of this femoral triangle. And once again, here is a closer look at the femoral nerve, femoral artery, and femoral vein that are passing through this space. Okay, so that was a lot of info that I just threw at you kind of quickly. So you may be wondering, what's a good method to recall this entire area of the upper thigh? Well, I've already kind of drawn out our little mnemonics in their corresponding places. So the first mnemonic device that I am going to use to help explain this part for you is sail. So let's start with the letter S in sail. The S represents our sartorius muscle on the lateral border of the triangle. Next, we have the letter A, which stands for our adductor or adductor longus muscle on the medial border of the triangle. And finally, the I and the L in sail stand for our inguinal ligament, which is forming the superior border of this triangle. So that mnemonic was pretty simple enough. Sail for sartorius, adductor longus, and inguinal ligament. Now I want to talk to you about the other mnemonic device that will help you keep our nerve, artery, and vein in their proper order. Now before I describe this little acronym, I want to reiterate the importance of orientation for this part. Again, we are looking at our right thigh. So that's how you know that the left side of the screen is the lateral portion of the thigh, and the medial portion of the thigh is on the right side of the screen that you are facing. This is important because the acronym is structured to be said from the most lateral structure to the most medial structure. Now, the acronym that I used to help me keep the order of the vein, nerve, and artery straight was by saying NAV. So to correlate this with our borders, you can picture yourselves out on the ocean trying to navigate the direction of your ship by hoisting the sail. So the N in nav represents our femoral nerve, the A stands for our femoral artery, and finally the V represents our femoral vein. And that is described in order of lateral to medial. Great, so now that we understand the component parts of the femoral triangle, I want to try to give you guys a quick little application question that you can use to practice. So this is just a short video of me performing crossbody swipes. This is an ab workout, but I want you to focus on the actions occurring at my thigh, so the hip joint. Which muscles that are innervated by the femoral nerve are assisting in the flexion of my thigh during this exercise? You guessed it. So, our sartorius muscle and iliacus muscles are two of the many muscles that are acting to help flex the thigh. and they're both innervated by the femoral nerve. Alrighty, so that is the end of this week's anatomy video. I really hope the example that I used made a lot of sense, and I also hope that I was able to clarify some things with the femoral triangle for you all. Okay, I'll see you all next week.